Good morning sir. I'm Ashigyo Alvaran from DSN 1B. And today I'm going to demonstrate how to do a proper bed shampoo and back care. But before we start, first, what are those two? Bed shampoo is the washing of the hair of the patient in bed. And then the back care means cleaning and massaging back, paying special attention to the pressure points. Next is, what are the purposes of bed shampoo? First, to maintain cleanliness and comfort of the patient. Second, to refresh the patient. And lastly, to wash the hair after application of a pediculicide. And then, the purposes of back care are: first, to give comfort to the patient. Second, to stimulate blood circulation. Third, to promote rest and sleep. Fourth, to prevent pressure sores. Fifth, to assess skin condition. Sixth, to relax and relieve tension in tissues and muscles. And lastly, to refresh the patient and release fatigue. There are also special considerations in doing proper bed shampoo that we have to remember. First, be sure that the procedure is ordered by the physician. Second, be certain that the patient is not febrile. Third, see to it that the patient is comfortable in his position. Fourth, arrange the calipad to allow the free flow of water from the head. Fifth, protect the patient from chilling and falling. Sixth, check the patient the feet temperature before the shampoo. 7. See to it that the bed is adequately protected. And lastly, observe the principles of body mechanics. Next is the special considerations in back care. First, for patient with history of hypertension and dysarrhythmia, assess pulse and blood pressure. Second, consider cultural preferences. Third, do not give massage if any discolorations in the skin is present. Fourth, a back massage should take about 5 to 10 minutes and can be given with the patient's bath before bedtime or any other time during the day. Fifth, determine if any allergies or skin sensitives exist before applying lotion to the patient's skin. And lastly, the greatest relaxation effect of a massage occurs when the rhythm of the massage is coordinated with the patient's breathing. After that, gather all the equipments in doing proper bed shampoo that we are going to use. I have inflated calipad, bath towels, newspaper, bed screen is optional, shampoo, pitcher of hot water, face towel, rubber protector, soap or hair shampoo, small pitcher, pail, alcohol, cotton balls, and comb. For the back care, I have lotion, oil, powder, or liniment. It depends upon the client which one will be used in doing the back care on him. Prior to the conduct of procedure, I have to explain the procedure to the patient. Good morning sir. I am Ashiki Alvaran, your student nurse for the day. May I see your wristband, sir? Please state your complete name, sir.
Tinager Baran.
And your birthday, please.
June 2, 2011.
Okay, thank you very much. So today I am going to wash your hair with shampoo. Would that be okay with you, sir? Okay, so I'll begin now. Arrange the equipments conveniently at the bedside, then close the door and the windows, and then turn off the air condition and or electric fan. Screen the bed when necessary and if you have. Lower the backrest and view rest if necessary. Line the chair and the floor with newspaper if necessary. And then prepare the water at the desired temperature. So now we will now proceed on doing the procedure by loosening first the top sheet and folding it at the waistline. This process allows the easy change of position. Next is remove the pillow. And then bring the patient's head on the edge of the bed by placing him diagonally across the bed. Working close to an object prevents overstretching, which causes muscle strain. Next is line a pillow with a rubber protector and towel. And place it under the patient's neck and shoulder so that the head is slightly inclined. The rubber protector prevents oiling of the pillow and the mattress. Such inclined position of the bed helps the flow of water from the head to the throat and not up the back, which may lead off the chilling. Next is we will insert the kelly pad under the patient's head with the throat directed towards the pail. The kelly pad receives and empties the water into the pail. And then comb the patient's hair to remove snarls. Next is cover the patient's eye with the folded face towel. Are you comfortable, sir? Such precautions protect the eyes from the soap, which may cause irritation and discomfort. Next is plug the ears of the client with cotton balls. This prevents the water from entering the ear, which may lead ear infection. Then we will now moisten the hair thoroughly. Then pour the soap solution on the scalp slowly, while the other hand raises and rinse, spreading it. The soap emulsifies hair oil and lowers surface tension of water, ensuring more effective cleaning. Massage the scalp with the finger, using the ends of the tips and not the nails. Massaging loosen accumulated debris, favoring better cleansing, as well as stimulating circulation in the scalp, necessary for a healthy hair. But using the nails in massaging the scalp irritates it. And then we will now rinse it and repeat the process by massaging the head until the hair is thoroughly cleansed. Taking care to avoid undue jogging or frequent turning off the hair. The soap, if it is not complete rinse off, irritates the scalp as well as make the hairs sticky. Undue jogging or frequent turning of the head may causes dizziness and discomfort. Rinse thoroughly. This provides a complete final rinsing and washing off any residue from the shampoo. Squeeze off the excess water from the hair and then remove the eye cover and the ear plug. And then with one hand, raise the head, while the other, remove the kelly pad and drop it to the pail. Rub the hair, then dry with bath towel that is placed under the head. And then readjust the pillow. Prompt attention to details of comfort enhances the patient's well-being and confidence. Next is move back the patient to the center of the bed. Lift the rubber protector until the hair is completely drawn, because wet hair causes chilling due to the cooling effect of evaporation. Okay, sir, I will now move you back to the center of the bed. And then arrange the bed linen and make the patient comfortable. Leave unit into the hamper. Clean used equipment and keep them in their proper places. So now after bed shampooing the patient, we will now proceed on the back care. First, do proper assessment of the general condition. To know about indication, special restriction, and mention contraindication. Next is explain the procedure and the purpose before the client to reduce the patient's anxiety and enhance cooperation to promote nurse-patient relationship. Okay, sir, I will now going to do your back here, which means that I will massage your back to give you a relax and relieve tension in your tissue and muscles. Would that be okay with you, sir? Okay, I'll begin now. Next is, before we start, maintain the patient's privacy like what I have done a while ago. Next is, switch on the light and switch off the fan. This is to maintain well-lighted and comfortable environment. Next is, ask the patient to void or offer the urinal to make the patient comfortable. Okay, sir, would you like to void at this time?
No.
Okay, got it. Next is adjust the bed in required height and lower the side rail on the caregiver side or near my side. And then provide side lateral or prone or sitting position according to the patient's condition. Next is ask the patient to come near to you at the edge of the bed. This is to make the patient comfortable and avoid back strain to caregiver. And then assemble all the articles at the bedside to facilitate time management and increase the skill performance. Spread the Macintosh or draw sheet to protect the bed from soiling. Expose the shoulder to sacral area. Then the other area should be covered with the cuff sheet to get access with the required area with a minimal exposure and privacy. Perform first the hand washing before we start back massaging to decrease the chance of infection. And then observe the skin condition of the back to find out any abnormal findings like redness. Next is pour the hot and cold water in the basin. And prepare the mixed water according to the patient's preference to provide comfort and avoid chilling. Can you touch it, sir? Is it okay with you? And then take the soap and do the ladder formation and spread it all over the back. From shoulder to sacral region to clean the dirt. And then after cleaning the back, we will now proceed on back massaging. Sir, which one do you prefer of putting on your back? Oil, powder, liniment, or lotion? Oil. Okay, got it. Provide massage with oil according to the patient's preference to avoid friction and be weather friendly. And then now take the oil in your palm and follow Swedish massage technique to lubricate the defined area. So the first movement that we are going to use is the clearage or stroking.
This is to revitalize and provide strength to muscles and nerves.
Next is the pet massage.
To break down fatty tissue.
Next is the friction.
To promote blood flow as well as circulation. And also to provide warm sensation and soften mucus in lungs.
And the last one is the complements.
To preserve the elasticity of the skin and to break down fatty tissue and preserve the elasticity of the skin.
And then after that, we will now remove the extra oil to avoid irritation and staining of the cloth. And then ask or help the patient to wear his clothes to maintain then provide a comfortable position to make the patient relax. Next is terminate or the articles to discard the waste. Keep the articles ready for the next time. And then lastly, do again the hand washing to prevent the chance of infection. And that will be all for proper bed shampoo and bucket.